Hello, my name is Chelsea Sherwood, and on behalf of Empire Interpreting Services, I would like to take the time to offer healthcare providers with this valuable Medicaid reimbursement information. Whether you are a private practice, hospital, dental office, or urgent care provider, among many others, this important information may apply to you. And specifically, if you provide care for a patient who is deaf, hard of hearing, or has limited English proficiency. If you have these services in place, you may already know the importance of having an interpreter present in accordance to Title VI of the Civil Rights Act and the Americans with Disabilities Act. Well, now we have great news. Medicaid will now reimburse providers for using medical interpreters to communicate with their patients during appointments. Medicaid's reimbursement is based on units. $11 is reimbursed for interpreting time of 22 minutes or less, and $22 is reimbursed when the interpreting time exceeds 22 minutes. This reimbursement process will cover only the time when the interpreter is actually interpreting for a medical provider. This excludes waiting room time, driving time, and the use of interpreters when dealing with administrative staff. For example, a Medicaid patient arrives to the emergency department in need of an interpreter. The ED calls Empire Interpreting Services to request the interpreter. An EIS interpreter arrives within 30 minutes. Meanwhile, the patient continues to wait an additional 30 to be seen. In the examining room, the doctor spends 15 minutes providing care for the patient. Tests are ordered, and the patient and interpreter are escorted to the imaging department. After the tests have been completed, the patient is asked to wait until the results are back. After 20 minutes, a new doctor enters with the results, and they have a 25-minute discussion between patient and doctor. They complete the discussion, and the patient is discharged. With this example, Medicaid will reimburse the hospital $11 for the 15 minutes the interpreter was interpreting for the first provider, and then an additional $22 for the 25 minutes of interpreting with the last provider. As a healthcare provider, small reimbursements such as this quickly add up, especially when dealing with a large volume of Medicaid patients. Review the links below for more information, or feel free to contact any one of our offices for more information.